Good morning and bienvenidos. I want to just thank you all for being here this morning for a really important initiative as it relates to Long Beach and COVID-19. My name is Robert Garcia. I'm the mayor of Long Beach. We're going to have remarks from Angelica Salas, who is our partner in this project, who's the executive director of CHIRLA, which is a coalition for humane immigrant rights. And also our state senator, Lorena Gonzalez, who also chairs the state senate and the legislative COVID pandemic statewide coalition and committee, and also Kelly Colopy, who's our director of health. We'll each be making remarks in English and in Spanish, and so we'll also have Spanish remarks in between each speaker, and then we'll open it up for any questions that we have at the end. And so thank you and welcome. I want to just begin by saying that we all know that COVID-19 is the most serious issue that we have facing cities here in the state of California and across the country. This is a pandemic that requires people and essential workers to work. It's a pandemic that affects especially communities of color and low-income communities. And we know, looking at the data, that one of the groups, if not the group that is most impacted, is our Latino community, our Latinx community, and in particular, immigrants and the undocumented. Now, we know that across the state of California, 61% of the cases are from within our community, the Latino population. Yet we only make up about 40% of the state population. So there is a huge disparity in the state of California when it comes to testing, the positivity rate, and those that actually live and reside here. I want to note why this is also very personal to me. I'm an immigrant. My mom, who passed away due to COVID-19, was an immigrant. And for 25 years, she worked with many patients that were undocumented and that were immigrants at her clinic when she was a medical assistant. Over the course of that time, she had many stories and understood that patients and people that are sick, especially if you are undocumented or an immigrant, you are less likely to seek help. You are less likely to trust the government. You are less likely to go to a clinic or to a hospital. And we know in conversations with our partners at CHIRLA that immigrants and the undocumented, especially in this moment, are incredibly fearful of the government, the medical response, and what's also incredibly sad is stories that you hear about many immigrants that are working that don't want to go get a test even though they are sick or have symptoms because they're afraid of losing their job in the workplace. And so we have people in our community that also don't know what their rights are, what the labor laws are. And so what we're hoping we're doing today is really creating a model, not just for the state of California, but also for the country. We believe that the model that we're launching today, specifically targeted to the undocumented and to immigrants, is the first of its kind in California and one of the first in the nation. While there are other mobile programs and other programs that are targeted to immigrants and others, this one is specific to our undocumented community. And so we're very excited to launch this program today. I also want to thank, of course, Governor Newsom, who has been incredibly supportive in the process for launching this program, and as from the statewide perspective of really putting a focusing on our undocumented and immigrant communities. Well, this program launches today, but will be in communities beginning tomorrow. It will travel through West Long Beach, through parts of Central Long Beach, through North Long Beach over the course of the weeks and months ahead, targeting immigrant populations and our undocumented neighborhoods. I want to thank Councilmember Roberto Uranga, who is here with us today, who is going to also be a part of this mobile clinic process in the weeks ahead. And now I want to say some remarks in Spanish, some brief remarks in Spanish, and then I'm going to turn this over to our next speaker. Mi nombre es Roberto García, soy alcalde de la ciudad de Long Beach. Hoy día estamos launchando este programa que es algo bien diferente y especial para el estado de California y también para el país. Ustedes saben también que para mí eso es algo bien personal. Mi mamá murió de COVID-19 Y ella era una inmigrante, como yo también, vinimos a los Estados Unidos cuando yo tenía 5 años. Ella también trabajaba en una clínica, y para esos 25 años que ella trabajaba en esa clínica, ella trabajaba con otros pacientes que también no tenían documentos. Y ella entendía que es bien difícil para gente que son latinos, que no tienen documentos, a tener acceso a aseguranza y ayuda médica. También sabemos que nuestra comunidad undocumentada, algunas veces especialmente en este momento y en esos años, tienen miedo al gobierno. Y también tienen, algunas veces también no saben cómo hablar con sus trabajos o donde trabajan, y tienen miedo de perder su trabajo si toman el examen y salen positivos para COVID-19. So, en este momento, esta clínica va a ir por todas las partes de la ciudad de Long Beach, que tenemos barrios que hay gente que no tiene documentos, gente que no tienen documentos que también son inmigrantes, para poder darles el examen de COVID-19 directamente en sus barrios, en sus vecindades acá en la ciudad de Long Beach. Este modelo es el primer en el estado de California y uno de los primeros también en el país. Con eso me da mucho orgullo poder tener este programa que empieza mañana por toda la ciudad, y sabemos también que esto vamos a replicarlo en el condado de Los Ángeles y por todo el estado de California. Estamos acá con otras personas que van a decir unas palabras, y con eso déjame por favor introducir a la senadora de nuestra área de acá de Long Beach y una gran amiga también en la ciudad de Long Beach, y la senadora Lorena Gonzalez. Lena.
Good morning, everyone, and thank you so much. Thank you to our mayor, our health department, Chirla, an amazing partner, and every single healthcare frontline worker here in the city of Long Beach. I can't thank you enough. It's so good to be home, and especially good to be home given these circumstances, knowing that we're being proactive about the COVID-19 crisis. I'm Senator Lorena Gonzalez, of course. My hometown is Long Beach. That's where I represent. I also represent Southeast Los Angeles, a place that is very hard hit in this community. As my role as a senator, over the last 4 months, I've been chair of the Senate Select Committee on the Pandemic Response. The Senate has been very proactive in ensuring over the last 4 months that we have held oversight hearings, one of which was on skilled nursing facilities, another on tracing and contact tracing and testing, and a third which was on the border region. Imperial County, also a Latino community with a lot of essential workers, has also had some oversight hearings, and we've done a lot of good work to highlight what we need to do a little bit better here as a state of California. And as the chair, for the past 4 months, we've been meeting weekly with the governor's office to ensure that we are getting the management of the state crisis in check and ensuring that we're looking ahead, especially as we're going to have the flu season arrive and knowing that we're not even in the second stage of this COVID-19 pandemic. And through this work, we've also ensured that equity and addressing the impact of COVID-19 on our underserved communities remains a priority, especially for our undocumented and Latino communities, as well as our African American and API communities. In regards to testing, some of the work in the last few months have included improving testing by adding more testing sites like pharmacies in our district, increasing access to testing supplies for providers, reducing testing turnaround times to 48 hours, and getting over 10,000 people trained on contact tracing to maximize containment of the virus, and ensuring to testing for everybody, regardless of age, race, income, or immigration status, as our mayor so eloquently mentioned. And here today, joining the City of Long Beach to share the work that has been done locally to make COVID-19 testing available to everyone. I want to ensure that it is, of course, equitable, and that we are always going into proactively working with the immigrant communities and our partners like Chirla to ensure that we're getting it right. So again, I applaud Mayor Garcia and our health department directors and all of our frontline workers here to ensure that we're increasing the access for our communities and, again, ensuring that we're doing this right. But we have a lot more work to do in the immigrant communities. And I look forward to the testing sites and seeing how the outcomes continue to improve. We will be holding oversight hearings as a state senate in October and November, and those oversight hearings will include the role of the essential worker and ensuring that we're getting the workplace regulations correct. We know that there have been cases in places like in my district in Vernon, Foster Farms up in Northern California, where people have died, and we cannot have that any longer as a state of California. And I encourage workers, parents, students, teachers, local city colleges, and everybody around here that has been deeply affected to ensure that we are working collaboratively, to take this COVID pandemic head on. And I'd like to say thank you again. Now in Spanish. Buenos días a todos. Me da mucho gusto estar aquí con ustedes el día hoy. Soy Lina González, la senadora del primer distrito. I'm forgetting that I'm actually in the Senate now. También tengo el cargo de presidir sobre el Comité Especial de Respuesta a Emergencias Pandémicas. Me ha dedicado a asegurar que todos tengan acceso a pruebas de COVID-19, independiente de la edad, raza, ingresos o estado migratorio de cada persona. Y es en este sentido que estoy aquí hoy, uniéndome a la ciudad de Long Beach, para compartir el trabajo que se realiza a nivel local para las pruebas que COVID-19 estén disponibles para todos. El acceso equitativo a las pruebas, especialmente para nuestras comunidades de inmigrantes y comunidades de color, es un tema muy importante. Hoy estamos trabajando cerca con el Estado, pero también con la ciudad de Long Beach. Con esto me gustaría decirle gracias al alcalde García, Chirla y todos los participantes en este movimiento. Y aquí estamos a su servicio siempre. With that, I want to say thank you very much again, and I want to pass it off to Angelica con Chirla. Thank you very much.
Good morning. My name is Angelica Salas. I'm the Executive Director of CHIRLA, the Coalition for Humane Immigrant Rights. CHIRLA is a statewide mass membership organization working at the local, state, and national level to create a just society fully inclusive of immigrants. We are pleased to be part of this partnership with Mayor Garcia in the city of Long Beach to urge immigrants to protect one another and their families, to take an important step to get tested. This partnership is aligned with CHIRLA's campaign that we call Porque Te Quiero, because I love you, which seeks to educate immigrants about the practices to prevent the spread of COVID-19, which includes testing. COVID-19 does not discriminate. However, immigrants and communities of color are more likely to suffer from the underlying conditions and work in industries that do not permit them to work from home. As a result, communities of color, immigrants, have suffered more, losing jobs and losing lives to COVID-19. In Los Angeles County, approximately 261,446 have tested positive, and we have lost 6,353 brothers, sisters, mothers, fathers, daughters, sons to COVID-19. Based on the data released by the County of Public Health, Long Beach has 11,503 positive COVID-19 cases and 238 deaths. The Advancement Project completed a study, and it ranked all 299 places in Los Angeles County and rated Long Beach with an index score of 60%, making the city one of the cities most impacted with COVID-19. And those impacted are mostly communities of color. The positive rate in infection among Latinos is 51.9%, where the total population of this community in Long Beach is 43%. The positive rate of infection amongst African Americans is 80%, where the total population of the community of Long Beach is 14%. While there is no vaccine, together we can defeat COVID-19 if we all do our part. CHIRLA and the City of Long Beach are doing our part to ensure that everyone, irrespective of race, of gender, of age, and yes, immigration status, have access to and are encouraged to get testing. My message to my immigrant brothers and sisters is get tested. It's easy, it's free, it's safe, it's confidential, and it will save lives. Buenos días, mi nombre es Angelica Salas, soy la directora de CHIRLA, la Coalición Pro Derechos Humanos del Inmigrante. Nosotros somos una organización estatal que trabaja localmente y también a nivel nacional para crear una sociedad justa que incluya a toda la comunidad inmigrante. Yo estoy muy contenta del trabajo que estamos haciendo en colaboración con nuestro alcalde Robert García y también con la ciudad de Long Beach, que trata de urgir a nuestra comunidad inmigrante que se protejan unos a los otros, a sus familias y que tomen un importante paso que es tomar la prueba de COVID-19. Esta colaboración se conecta con el trabajo que nosotros estamos haciendo con una campaña que se llama Porque te quiero, Because I Love You, que lo que trata de hacer es educar a nuestra comunidad sobre las prácticas que previenen el contagio de COVID-19 y eso incluye las pruebas. COVID-19 no discrimina. Sin embargo, la comunidad inmigrante y las comunidades de colores siempre están sufriendo mucho más porque tienen condiciones de salud y están en trabajos que no los deja trabajar desde casa. Son estos trabajadores esenciales y queremos cuidarlos. De este resultado, nosotros lo que vemos es que nuestra comunidad ha sufrido demasiado. Están perdiendo sus trabajos, pero peor sus vidas por el COVID-19. En el condado de Los Ángeles, nosotros tenemos aproximadamente 261,000 personas que han probado positivo y se han perdido 6,353 vidas. Esos son hermanos, hermanas, madres, padres, son hijos y hijas. Todos, ¿verdad? Que es un gran pésame para todos. Basado en toda la información que tenemos en el condado, Long Beach tiene 11,503 casos positivos y ya se han muerto 238 personas. El proyecto de Advancement, que es un proyecto de análisis sobre ese tema, ha completado un estudio sobre todas las ciudades aquí en el condado de Los Ángeles y ha demostrado que la ciudad de Los Ángeles tiene un promedio de 60% de contagio. Y esto está impactando a nuestras comunidades de color y a nuestra comunidad inmigrante. Y nosotros como latinos estamos comprobando al 51.9%, aunque en la ciudad de Long Beach solamente hacemos el 43%. Y entonces nosotros sabemos muy bien, ¿verdad?, que en este momento no hay una vacuna y nosotros tenemos que derrotar el COVID-19, tenemos que hacer nuestra parte. CHIRLA con la ciudad de Long Beach, con nuestro alcalde Robert García, con nuestra senadora Lorena Gonzalez y con todos los que se apuntan a esta lucha, estamos haciendo nuestra parte para que independiente de tu raza, tu género, tu edad y definitivamente tu estatus migratorio, tú tengas acceso a la prueba y también nosotros promovemos es que uses esta prueba. Mi mensaje a mis hermanos inmigrantes, a mis hermanas inmigrantes es agarren esta prueba. Es fácil, es gratis, es confidencial y va a salvar las vidas de nuestra familia, va a salvar vidas. Hay que hacerlo y aquí está la oportunidad para que lo hagan. Muchas gracias.
Good morning. Thank you, Angelica. And thank you all for being here as we kick off this very important program. I want to share a little bit about testing. So you've been hearing about the concerns in our community, the fear of being tested, but I want to share about how easy it is to be tested. So testing is critical in preventing the spread of COVID-19, and we're so pleased that we're going to be able to take this opportunity to make it more localized and to help people understand the safety of the process and also the safety for their workforce. It's free, and it only takes a couple minutes. So here's how it works. The mobile testing site will provide a nasal swab test, which means that the samples are collected by swabbing somebody's nose. Individuals can do their own, or they can have someone do it for them. These trained staff members that you see back here will be out there at the site. Face coverings are required unless you are exempted for medical reasons, and physical distancing will be enforced. It's very important that if you have COVID-19 symptoms or you've been exposed to someone who has or is likely to have COVID-19, that you get tested. Testing tells you, and it tells us, your public health professionals, the likelihood that you're infected at the time that you get tested. The COVID-19 test is very good at detecting the virus. It's very uncommon to have what we call a false positive. So if you get a positive test, there's a 99% chance that you have COVID. In other words, if you have symptoms and receive a positive test, we're confident that you actually are infected. Those who are infected must take immediate steps to further prevent the spread of the virus. This means self-isolating at home and letting anyone that you've had close contact know that they have been exposed and that they should self-quarantine. A negative COVID-19 test result does not mean necessarily that you are not positive. It means you're not positive at that moment, that you don't have enough in your system to detect it. It could take up to 14 days for a person to start to experience symptoms or to have what we call the viral load that's high enough so that it can be detected. This is why it's so important that if you've been exposed, to quarantine for the 14 days if you know that you have been around somebody. You also, important for everyone to learn about the ways to stay safe from COVID and to do everything it takes to keep safe and keep your family and your friends safe as well. This means keep your physical distance 6 feet away all times for anyone that you don't live with. This includes the family members who live outside of your household. Wear a face covering whenever you're around people that you don't live with. Wash your hands frequently and disinfect high-touch surfaces often. Sorry. It's a little windy out here. Cover coughs and sneezes with a tissue, and then throw the tissue in the trash and wash your hands. And of course, anyone who has symptoms of either flu or COVID-19 should stay home and avoid spreading the illness to others. Always consider that you and everyone that you come in contact may be contagious. We like to tell people, pretend that you and everyone around you has it and do everything you can to keep people safe. I want to share a little about the data. We in public health spend a lot of time with our data. In fact, we look at COVID-19 data every day. COVID-19 cases increased from March until the end of July when we issued the safer at home order in March, and we had to close down much of our city. It's been really hard on all of us in the city, our communities, our families, and each of you. Since then, our cases have stabilized and they've started to go down. You're starting to see things open up a little bit more. But we continue to watch our data to understand where we're having outbreaks, where people are overrepresented, to understand exactly what's going on in our community and what steps we need to take. We were as high at a time to have 35 cases per 100,000. We're now down to 6 per 100,000. That shows you the decrease. We're at the lowest point in months. But we are using these data to understand exactly what communities we want to be doing our pop-up testing. It's these data that are indicating where what we call our COVID hotspots, and that is where we are setting ourselves up, both tomorrow and then over the weekend at our different testing sites. The pop-up testing will help us reach many more people so that they understand and know about COVID and that they can find out if they are positive and if they need treatment or need to quarantine or isolate. I want to thank you for your patience and your partnership in reducing COVID-19 in Long Beach. Thank you.
I think we're going to do some questions first, and then at the end of the questions, we'll do the translation for the health department piece, just to make sure that we stay on time as well. So, are there any questions? Yeah, I mean, I think so statewide, we know that 60% of the cases that are coming back are within the Latino community, and it's 40%, of course, of the population are Latinx across the state. So the disparity is real, and you're seeing that actually in reports that are happening all across the country. This is happening not just here in LA County, it's happening in Marin, it's happening in the Central Valley, it's happening all up and down the state of California. So we're really focused here. We know that a lot of immigrants and a lot of the community are actually not getting tested. And so the issue is even though we have data that shows that that we have obviously positive tests and that we have folks that are getting tested, there's a huge populations that are not getting tested. They're choosing to take a risk between work and test because they have no other option but to work for their families because of all the other disparities like economic immigration status. So that's a big issue. And so if I need to answer that in Spanish, I can, unless we can go on. Any other questions?
Mayor Garcia, how many trucks are there like this in LA County, and how much of an impact do you think one truck would make in Long Beach?
So this is our first mobile unit in Long Beach as it relates to really being focused on the undocumented community and on immigrants. There are other programs like this or other mobile clinics that are happening in LA County and across the state, but we believe this is the first of its kind as it relates specifically to undocumented populations and populations as it relate to immigrants solely, because it's not just the clinic. What Sheila is going to do, and Angelica can maybe comment on this as well, is they're going to be providing education. So they're providing worker rights education. They're providing access to ensuring that that people know what their rights are in the workplace, what their workplace may or may not be able to do to them if they actually get sick, how they can access other health care. So we think this program is going to replicate very quickly up and down the state. And I don't know if Angelica, you want to add to that. We'll get there.
So CHIRLA runs an immigrant assistance hotline, and through that hotline, we've been able to have conversations with our community as well as all the work in organizing with workers. And what we find very much is that first, our community needs us to say this is safe. This is you can trust the city of Long Beach, the health department, with your health, but also with the information. But then, let's say you do test positive, then they're going to be afraid about will I lose my job? We've seen people who have lost their jobs, or who have suddenly, maybe tested positive, went into quarantine, and then weren't taken back. There's a lot at stake, and it's this, a lot at stake in terms of your lives, but also with a positive test, a lot at stake in terms of the workplace, and also what does that mean for my family? And so what we're partnering with the City of Long Beach is one to have access to the test, know that it's free, confidential, and it's easy, certainly. But then to also have the information post the test so that you can continue to understand how what are your rights as a worker? Let's say you do get sick, what access do you have for health care, long-term health care? What are those needs that you have? And then we can guide you. So what we're trying to do is to have a comprehensive testing approach where it's not just about the test, it's about all the other information you need once you've completed that test. Y en español, brevemente, nomás lo que estamos haciendo con la ciudad de Long Beach es asegurando que nuestra comunidad, primeramente, ¿verdad?, los motivemos a tomar esta prueba, pero también necesitan información sobre si prueban positivo, ¿qué va a pasar? ¿Qué va a pasar en el trabajo? ¿Qué son sus derechos laborales? Pero también queremos que nuestra comunidad sepa sobre qué acceso a cuidado médico, qué son las cosas que son cubiertas por la ciudad, por el condado de Los Ángeles y también a nivel estatal, para que de esa manera tengamos una meta de que con la prueba, no nomás sea la prueba, sino todo lo demás que tú necesitas para poder lidiar con esta situación. Okay. Gracias.
Any other questions? Vamos a poner la información por website, pero también es porque tenemos un partnership con Chirla, porque Chirla trabaja en esas comunidades, ellos saben dónde está la gente que necesita tomar el examen. So Chirla va y su team van a estar en las comunidades también a pasar la información. También en el Health Department y nuestros trabajadores van a ir a casa a casa, van a ir en las neighborhoods para también poner la información a toda la comunidad. So, gente va a saber y también por toda tu ayuda también la comunidad va a saber cuántos los días son. Tenemos flyers que tienen todas las primeras 3 clínicas que van a pasar esta semana y van a haber más y más clínicas también. O no vamos si gente que viene vamos a poder dar el examen. Ahorita estamos haciendo unos maybe 1,500, 15,000. We have capacity to do about 1,500, 1,600 tests a day right now, the capacity. And so en estas clínicas podemos hacer, si gente que viene, le vamos a poder dar un examen. Y si viene tanta gente que no tenemos la capacidad acá, los podemos también llevarlos a una de nuestras testing sites en la ciudad para que puedan tomar el examen ahí también. Any other questions or anything else? I think it's a good question. So I think one thing that a big part of COVID is we're learning an enormous amount. And early on, the city of Long Beach, I think, has one of the best and has had one of the best testing programs in the state. In fact, we were doing double the amount of tests that the state required of us. We were doing double that in the city of Long Beach. So we had very aggressive testing sites and testing sites all across the city. But the one thing that we learned over the course of the last few months is that the undocumented community and immigrants, we needed to really change the way we're communicating and providing the tests to them. So that's something that we've learned. I think the state of California has learned this. So this is something that should have been happening months ago. And now we've got to do it moving forward and learn as we go. I'm not sure if, do you want to add anything to that?
I would say the same thing. I mean, absolutely, the city of Long Beach has been an incredible partner with the state. I don't want to sugarcoat things for you, but what I would say is where we have rural communities right now that come to the committee on the pandemic response and are still waiting 4 hours. They're 4 hours away from testing, and we still haven't figured it out in rural communities. The governor also expended quite a large, big investment in the Central Valley for farm workers as well. We still know that there are pockets like Southeast Los Angeles and here in Long Beach that have a very high rate, but it's sort of toppling and leveling off. But that's because of the work of the testing that was done on the front end, even before the state mandated a lot of this and the state started the mobile program. So I'm thankful that Long Beach got on top of it because we do know that friends in Orange County as well, we had Quest Diagnostics that many of them were working with, where testing turnaround times were 16 days for essential workers in Santa Ana. Like, that is unfortunate, and at that point you have to just completely retest. Many of those essential workers were actually coming here to Long Beach is what we found because there were testing availabilities with no questions asked. And that's what I think we need to highlight and continue pushing forward in this city, but also for other regions of LA County as well. But thank you for the question.
Is there any final questions before we wrap up? Okay, great. So thank you very much for joining us. We're going to do, for anyone interested, Kevin, what did you say we're going to do? Oh, okay. Yeah. If anyone needs any other individual interviews with anyone in Spanish from the health department, please let us know. So thank you for joining us. And again, as a reminder, these tests are free. You don't need insurance. You don't need any sort of documentation, and it's safe and secure. So please participate. We want the community to be involved. Thank you.